Hi everyone, this is Murali Rajkonda. Today we are going to have a discussion about radiation oncology with Dr. Sai Snehith sir, consultant radiation oncologist, Vijayawada. Hi sir, good morning sir.
Hi, and hi to everyone.
Today we are going to discuss about radiation oncology and its role in cancer treatments. Let's start with question number 1 sir. What is radiotherapy? What is the role in cancer treatments?
So basically radiation therapy is a type of medical treatment where we use ionizing radiations which are very high energy to treat and kill the cancer cells or tissues by minimizing the dose to the surrounding areas of the body. This is called radiation therapy treatment. And coming to the usage of radiation treatment in cancer, so here we use radiotherapy in 4 modalities of manner, where curative one is curative intent, where we use radiation therapy as a primary modality of treatment along with chemotherapy, and the second intent is adjuvant, where we use radiotherapy after surgery or chemotherapy as a part of adjuvant treatment. And one more is neoadjuvant intent, where we use radiation therapy before the start of primary modality like surgery. And fourth one is palliative intent, where we use radiation therapy as a part of treatment modality, where we decrease the symptoms or any problems associated with cancer.
What are the different types of radiotherapies? How do they differ?
Radiation, coming to the radiation types, we have basically 2 types of radiations. The first one is ionizing type of radiation, and the second one is non-ionizing type of radiation. In ionizing type of radiation, here the energy of the radiation is very high, where the energy will go and knock off the electron in the atom, and thereby it causes a ion. So the name comes from this ion, called as ionizing radiation. The radiotherapy uses mostly the ionizing type of radiation. Coming to the non-ionizing type of radiation, here we have the examples of microwaves, radio waves, and the other type of UV rays. All these kinds of radiations comes from the non-ionizing type of radiation. In ionizing type of radiation, we have X-rays, electrons, and protons, and gamma rays. All these comes under ionizing type of radiation.
What is the difference between internal radiotherapy and external radiotherapy?
Okay. Coming to the external beam radiotherapy, here the X-rays what we use for radiation therapy treatment comes from the external source, like a mission called linear accelerator, which we call as LINAC. From this, the X-rays are generated, and these rays will be directed to the tumor tissue to destroy it. So, as the X-rays are coming from the external source, from a mission, we call it as external beam radiotherapy. But coming to internal radiotherapy, which we call it as brachytherapy, here we insert a radioactive sources inside the tumor or nearby the tumor. So, these source will emit radioactive what we call radiation, thereby destroying the tumor tissue. So as we are going inside the body to place the radioactive source, that is called internal radiotherapy or brachytherapy.
Okay. Do all patients require radiotherapy?
Definitely not all cancer patients require radiotherapy, but approximately 65 to 70% of the cancer patients requires radiotherapy in some form of treatment modality. So if you take cervical cancer patients, definitely radiotherapy is the primary modality of treatment. But if you take in rectal cancer or head and neck cancer, few forms of oral cavity cancers, here it is part of adjuvant treatment. So after doing surgery or before doing surgery, we will use radiation therapy as a part of treatment.
Okay. How long does a typical radiotherapy session last, and how many sessions required to patient?
So typically a radiotherapy session lasts for about 30 minutes to 40 minutes. And this is external beam radiotherapy. Coming to internal radiotherapy, it lasts like application takes around half an hour to 1 hour, and delivering the dose takes another half an hour to 1 hour. So typically, external beam radiotherapy is most commonly used. So typically, a radiotherapy session lasts for about 30 minutes, and number of sessions for a particular patient depends upon the type of cancer, stage of cancer, and the location of the cancer. Typically, in cervical cancer patients, we give around 20 to 25 to 30 radiation sessions. And for another example, if you take any head and neck cancer, we give around 30 to 35 radiotherapy sessions.
Are there any specific preparations to start before radiotherapy?
Coming to the preparations mean if we want to start a radiotherapy treatment, if you want to start a patient for radiotherapy, first we do a medical evaluation for overall fitness of the patient, and we take the history of any pre-existing illnesses like diabetes, heart issues, or any other kind of problems. And once the radiotherapy treatment sessions start, then we give some precautions for the patients for their skin care, like oral hygiene, and to take adequate nutrition, and to maintain adequate hydration.
What should patients expect during radiotherapy? Is it painful?
So basically, a radiotherapy session doesn't cause any pain to the patient. For example, if you are undergoing a CT scan, we are using low energy X-rays while doing a CT scan, but here we are using high energy X-rays. So it typically looks like or feels like a CT scan, which doesn't give any kind of pain.
Other than cancer, what kind of medical conditions can be treated with radiotherapy?
So many other non-cancerous conditions also can be treated with radiotherapy. If you take, for example, benign cancers, benign tumors in the brain like pituitary adenomas, acoustic neuromas, and many other kinds of benign tumors in the brain can be treated with radiotherapy sessions. And along with that, many vascular conditions like hematoma, hemangiomas, and arteriovenous malformations also can be treated with radiotherapy sessions.
Can you brief me about the process of radiotherapy before starting?
So, the workflow pattern, how a radiotherapy session lasts is like once the patient is planned for a radiotherapy treatment, then we'll take a simulation CT scan with by using certain kinds of immobilization devices. Immobilization is very important for radiotherapy session because we have to immobilize the patients completely so that we can reproduce the same while giving the treatment. So that we can easily and precisely can direct the X-rays to the target site, and we can destroy the cancer cells. So along with CT scan, we'll do immobilization and we'll do a CT scan. Then on those CT scan images, we'll plan the radiotherapy treatment. Then we'll deliver the plan to the patient.
Okay. What are the common side effects of radiotherapy and how are they managed?
Like any other medical treatment, even radiotherapy is also associated with few side effects, and the type of side effects depends upon the location of the tumor and where we are giving radiation. So if you take an example of cervical cancer patients where we are giving radiotherapy, usually the most common side effects is diarrhea and the skin irritation at the site of the radiotherapy plan. And if you take a head and neck cancer patients, a patient will experience a pain while swallowing the food. In such cases, we give a medication to manage that. Otherwise, these side effects are very tough.
Is radiotherapy used for palliative?
So, radiotherapy is used as a palliative intent also. Usually, the palliative intent comes into play when the patient cancer is advanced or incurable. In such cases, we'll give radiotherapy to decrease the symptoms of the patient or to stabilize the functionality of the patient. Take example of a lung cancer patient with bone metastasis, where the patient is experiencing severe pain due to bone involvement. Here we give radiotherapy to the bone so that the pain due to bone damage is decreased. And we can also improve the functionality of the patient by giving certain locations of cancer by treating with radiotherapy.
Can patient eat normally in radiotherapy treatment?
During radiotherapy treatment, there are no dietary restrictions unless the patient is not having any pre-existing illnesses like diabetes or heart issues. So usually we'll encourage the patient to take high protein food and encourage the patient to get adequate hydration also.
Can patient continue working during radiotherapy treatment?
Working during radiotherapy is possible unless the patient should be mentally and physically strong, and during radiotherapy sessions they might experience little fatigue, but this can be overcome by patient and their surrounding family support system also.
Thank you, doctor. Thanks for giving more information about radiotherapy and all. Thank you very much, sir, for your valuable information about radiotherapy and in cancer treatments. Thank you. Thanks for watching our live session. If you have any queries and questions, please comment on our chat box. If you want any more information about cancer, please subscribe our channel, American Oncology Institute, Vijayawada. Thank you.